Hi, I'm Dr. Sue Ann Morrow, and I serve as the Employment Services Specialist for Iowa's Money Follows the Person. Today, we want to talk a little bit about Employment First. You'll notice we have three graphics up there. One is the Iowa Employment First logo. The second one is Iowa APSE, which stands for the Association of Persons Supporting Employment First. Iowa APSE has been a leader in promoting and forwarding Employment First in Iowa. Then, of course, we also have the State of Iowa logo. Across the nation, Employment First is viewed as a philosophy, a movement, and sometimes a policy, directive, or law. It states employment is the first priority and preferred outcome of publicly funded services for people with disabilities. It's also a framework for systems change that's centered on the premise that all citizens, including those with significant disabilities, are capable of full participation in integrated employment and community living. This has not been a sudden occurrence, but rather past legal decisions and changes in the emphasis of funding has slowly built the case. Over the past 20 years, trends in federal legislation, federal policy guidance, regulatory changes, and legal interpretations of the state's obligations under the Americans with Disabilities Act, along with state policymaking, have created a new environment with different expectations and rules for the provision of employment and day services for people with disabilities. There's also changed the expectation of the outcomes of these services. Why? Why has this change come about? Probably the biggest change is the Supreme Court's 1990 decision in Olmstead versus LC, which affirms Title II of the ADA, the Americans with Disabilities Act, prohibiting unnecessary segregation for people with disabilities. Olmstead requires that people with disabilities receive services in the most integrated setting appropriate to their needs. This ADA integration mandate is administered by the Civil Rights Division of the United States Department of Justice. Recent Olmstead enforcement actions by the U.S. Department of Justice include, in July of 2011, the Statement and Technical Assistance Guidance making clear the public entity's obligation regarding integration. In 2012, there was a settlement in Virginia confirming that the priority service option for individuals with disabilities should be integrated employment. Again, in 2014, there was a settlement in Rhode Island that required them to increase the opportunities for integration for transitioning age students. And then again, in 2015, Oregon's settlement agreement required that Oregon move people out of sheltered workshops into competitive integrated employment. So a lot of rulings around the Olmstead and integration. A second major force are the changes in the Centers for Medicare and Medicaid Services, CMS, which run the Medicare and Medicaid. They administer Medicaid, which states can provide home and community-based services through different waivers. Support for integrated employment services from CMS and their Medicaid services really started probably in 2011 with their guidance on employment for individuals in Medicaid home and community-based services. That guidance updated the definition of pre-vocational services and more clearly illustrated how waiver dollars could be used to increase community employment. In January 2014, there was the final rule on home and community-based services, intending to ensure that individuals receiving these services, and I'll quote, have full access to the benefits of community living and the opportunity to receive services in the most integrated setting appropriate. Those were big changes for the Medicaid services. Another why is the transition amendments of the Individuals with Disabilities Education Act out of the United States Department of Education, whose purpose is, and I'll quote again, to ensure that all children with disabilities have available to them a free, appropriate public education that emphasizes special education and related services designed to meet their unique needs and prepare them for further education, employment, and independent living. Again, you see that word employment. The Rehabilitation Act, the federal law governing the provision of vocational rehabilitation services, which has a presumption of employability in integrated settings for all individuals with disabilities, including those with the most significant disabilities. And that act made it possible for VR not to count placement in segregated settings as successful placements. They're really focusing on integrated employment. Another why comes with the Workforce Innovation and Opportunity Act of July 2014, which requires state agencies to work together to improve community-integrated competitive wage employment for youth and adults with disabilities, and expands the role of VR agencies with transition-aged youth, limits the number of transition-aged youth entering sheltered workshops and working for sub-minimum wage, and enhances the roles of the workforce system in meeting the needs of people with disabilities. I'm sure you guys are well aware of WIOA. Let's look at what Employment First stands for. It's a simple but powerful statement. It states that employment in the general workforce should be the first and preferred option for individuals with disabilities receiving assistance from publicly funded systems. Basically, we're talking about that any agency who gets money, who gets public dollars to provide employment services should be focusing on integrated community employment outcomes. Let's start with Employment First as a philosophy. In general, Employment First says that all individuals can work when given the right supports. Some are going to require more supports than others, but Employment First begins with the assumption that all folks can work. This is a very different philosophy from the past, where people had to show that they were ready to work. Indeed, some people were even considered too disabled to work. We know that now, that given the right supports and different strategies, everyone can work. This change obviously means raising expectations of individuals with disabilities themselves, their families, community rehab staff, school personnel, state agency personnel, and really just about anybody who works with individuals with disabilities. It's clear that Employment First means that public employment service dollars should be used to support integrated and inclusive employment, not segregated employment such as sheltered workshops, which here in Iowa tend to operate as pre-vocational or training services. This change affected the Medicaid services the most. Vocational Rehabilitation Service had stopped funding segregated employment in the early 2000s, as I mentioned, and I don't think workforce centers ever funded long-term segregated services. So like I said, the philosophy represented the biggest change for Medicaid long-term services and supports. Historically, Medicaid had funded training being conducted in sheltered workshops through their pre-vocational dollars. Unfortunately, lots of people stayed in this training phase for many years. It's noted that more people died while being trained to work, in quotes, than moved out of sheltered workshops. We all know that individuals who work have a positive impact on the economics of their community. This is true for individuals with disabilities. Even knowing this, employment statistics for individuals with disabilities are dismal. Additionally, more individuals with disabilities live in poverty than their peers without disabilities. Recognizing this needed to changed Employment First from a philosophy to an Employment First movement. There might have been earlier adopters, such as Tennessee in 2002, but probably the state that had the most impact on the movement was Minnesota. In 2007, they published the Minnesota Manifesto on Minnesotans with Disabilities in Integrated Competitive Workforce. In the document, they wrote that Employment First is the vision of making employment the first priority and preferred outcomes for people with disabilities. As used in that manifesto, they defined that as means I'm quoting here, expecting, encouraging, providing, creative, and rewarding integrated employment in the workforce at minimum or competitive wages and benefits as the first and preferred outcome for working age youth and adults with disabilities, including those with complex and significant disabilities, for whom job placement in the past has been limited or even traditionally not occurred. And we all know that different agencies define employment differently. So Minnesota took the step to define what they mean as employment. And they defined it as regular or customized employment in the workforce where employees with disabilities, I'm quoting again, forgot to tell you that, are included on the payroll of the competitive business or industry, unless the person's self-employed, where the assigned employment task offer at least minimum or prevailing wage and benefits, and offer ordinary opportunities for integration and interactions with coworkers without disabilities, with customers, and or the general public. I think you can see how some of their language made it into parts of WIOA where competitive integrated employment was defined. Employment First movement was also had the assistance of the Department of Labor, the Office of Disability Employment Policy. In 2012, they sent out a request for proposals to help forward the movement. ODEP recognized that lots of states wanted to align their efforts and support individuals toward an employment first approach, but some states didn't possess the capacity or have the experience or technical assistance or technical resources to lead and facilitate that change. To address that, ODEP initiated the Employment First State Leadership Mentoring Program. It's a cross-disability, cross-systems change initiative. Employment First State Leadership Mentoring Program provided a platform for multidisciplinary state teams to focus on implementing the Employment First approach through the alignment of policies, coordination of resources, and updating service delivery models to facilitate integrated employment options for people with the most significant disabilities. And we're happy to say that Iowa has been involved in this initiative since the beginning in 2012. Some states have taken employment first from a philosophy to a movement to a requirement. If you look at the map, 4 states have legislation and a directive or an executive order. 13 states have legislation, for example, and that looks all different for the different states. Some states have legislation where they've changed the rehab commission that runs the rehab services. I know in Colorado, I believe it's Indiana, where they're required to have a baseline of the number of people with disabilities working, and then they set annual goals to increase that. Maine, in their legislation, developed a Maine Employment First Coalition, and they're to work with, it has a very specific required membership, and they focus on what the state agencies must do, and it also stresses that integrated employment must be the first and preferred option when providing services to people with disabilities. 16 states have directive or executive orders, 17 states have other employment activities, and 1 state has no activity. You'll notice that Iowa is noted as having other employment activities. That's mainly due to our Employment First State Leadership Mentoring Project work. There's been some work on getting a directive or an executive order, but so far we haven't been successful. Employment First is a big deal. It's a national movement. Some states are ahead of others, but it's clear from the map that the belief of integrated competitive employment for all is a real thing. We've discussed how Employment First is a philosophy, can be considered a movement, and in some states, a directive or a law. There's a lot of momentum for Employment First, not just here in Iowa, but across the country, to help individuals with disabilities gain access to competitive integrated employment. And it started with the notion that employment in the general workforce would be the first and preferred outcome of publicly funded employment services. Thanks for listening. If I haven't made anything clear, or if you have a question, feel free to give me a call or an email, and I'll be glad to discuss it with you. Thank you.